Tonight we are going a little deeper. So I am Dr. Marcia Levi, and tonight we are going through insights with Dr. Levi. There are deeper insights that happen every 90 days, but these insights are an opportunity for me to sit, pause, and talk with you about topics that are important to the healing process. And so many people come to me, not only women, but men may report back pain. But one of the unique things that I find is most times when a woman expresses back pain or low back pain or pelvis pain, there's not a full understanding of the fact that it can be more than the bones. So I move bones, but when I move bones, other things happen. I recognize that right now, society has a huge conversation around menopause. And every time I hear it, I usually hear trauma and fear and concern and anxiety around it. And the conversation around menstruation isn't happening, but it's equal. Menstruation is menopause, and menopause is menstruation. And by the end of this presentation tonight, I am prayerful that you understand that balance, understand the equilibrium of what is going on inside of the body, and recognize that while you might be in one phase or stage, there's a young lady who is hearing and is being frightened by a process that's very normal, is very natural. So people say, well, I have to, calm the hot flashes down. We're going to talk more about it. So pain is a big problem. Most people register pain. And so they will tell you that I this is what's driving me to getting an answer. But we'll see that there's more than pain around it. As always, I am faith-filled. So the word for tonight is bless the Lord, O my soul, and all that is within me. Bless his holy name. Psalm 103, verse 1. I'm using the ESV version. And it says, bless the Lord, O my soul, and all that is within me. And therefore, I want to encourage you to know that menstruation and menopause all the way through is a divine order from God. In Genesis 3:20, when Adam named Eve and called her mother of all living things, in order for you to have life, there needs to be an expression of life. And that's where that whole menstruation journey comes, because it's a signal for fertility. You'll see as we go on a little later. So just my encouragement to you tonight is to consider this psalm or any scripture or any faith-based reading that brings encouragement to you in the middle of this big process. We, as always, discuss the 5 principles to optimal health, because for me, as a chiropractor, balanced nervous system is the foundation to all healing. That's your tabletop. There are 4 legs that support that tabletop: nourishing foods, appropriate exercise, adequate rest, which is different. That's rest is going to sleep versus relaxation, and always a positive mental attitude. So tonight, we're actually finding ourselves talking about your attitude, your mental attitude, making it positive towards something that can be very frightening. As a doctor, if I use the word pelvic, I mean your organs and soft tissue. So you'll hear people say, I have pelvic pain, and I'm talking about the organs, and then muscle, tendon, ligaments, including the blood vessels. Because if you have a hemorrhoid, that's part of the pelvic region. And then the pelvis, you'll hear us talk about the pelvis. That's the bony bone, and I'll show you some pictures a little later. There are 3 big joints, and then there's some small ones that need to move and stay in alignment so that the organs and the other soft tissue can sit nicely in there. I refer to menstruation as fertility's doorsteps, because there are multiple levels to menstruation. There's peri-menstruation. We were talking a little earlier about the start of the expression. Most people think of the menstruation as where the blood starts to flow, right? The uterus is shedding unused lining, and we're going to talk about that a little bit. But menstruation actually starts a little bit more what we call in the process of puberty. So it can start as early as 5 in some young ladies, and you can see it usually expressing itself about age 7. You're born with all the eggs you would ever have. So then the body prepares it for fertility. So menstruation is a series of steps It's not like you're menstruating, because if you remember, menstruation came spotty. It came and then it expressed itself a few months later. For some young ladies, it came and it did not come again for another year. That's why for me, menopause is puberty in reverse. Those two are terms that I use: fertility's doorsteps and puberty in reverse. A reminder that in menstruation, the uterus is shedding unused lining. So a person can be pregnant, you've got a fertilized egg feeding into the lining and growing, but the uterus decides that it has too much lining, so a woman can still spot. She can still spot, she can have a cycle and still be pregnant. So that is a caution. We don't want too much spotting because that means the baby doesn't have enough lining to grow on. Menstruation is a cycle. The body's going to go in and out of the cycle, and it varies. Every woman, it varies. It can be from 22 to 24 to 26 to 28 days. Some women, it's a little longer, some it's a little shorter. The average, I have 5 here as a reminder, the average expression day. So you have this ramp up that happens, just like my hands. It ramps up, then it expresses for an average about 5 days, and then it fades off. So you can have 2 days of expression all the way up to 7 days. More than 7 days, we start to get a little concerned about anemia and a couple other things, or why is the body doing this growth why is this lining so built up that it has to take longer than 5 days? And then menopause, puberty in reverse. You go through the regular cycle and then it starts to fade and then it spins a spot. So it's an opposite of menstruation. It is puberty in reverse. It's the end of the production line. God has given us grace to say, you don't need to have a cycle anymore. I have some other things for you to do, like practice wisdom and be a great auntie, right? So menopause is a line. The body starts to move from this up and down cycle, and you'll see I have a graph in here, and it lines up. The average measure, every woman is different, is about 12 months with any blood expression. However, most women, after you've had 12 months of nothing at all, then there's one cycle that comes with a big gush, where the body, so for about 12 months, you've had no bleeding. And then all of a sudden, you get this big cycle, and everybody goes, whoa, I've got to get to the gynecologist because what is this bleeding? Is this cancer? The body has scraped itself and it's taking everything out to the cabinet and it does one big dump. So if that ever happens, I'm not saying don't go to the doctor. You still want to go to your gynecologist and get checked, but don't be afraid. It is just a normal, healthy process. The body's getting rid of what it needs to get rid of. We cannot talk about menstruation, menopause without talking about our bones. If you're sitting too much, standing too much, and you're not moving very well, because these organs that I spoke of earlier in the pelvic bowl and that in the pelvis area, they need movement. It's like a big hammock. It's not going to sit there. The uterus is not just going to sit there. It needs movement. The brain has to talk to the body, and it uses the nerves to do so. And then you'll hear me talk about muscle, tendon, and ligaments in a moment. And the differences of people who are not familiar with these is muscles are soft. It's elastic, and it's always blood filled. Some of them move voluntarily, like I can close my eyes, but blinking regularly is an involuntary movement. I don't control that. My eyes will blink when it wants to. So your body will start clamping your uterus to get rid of blood flow whenever it's ready. It will also shrink the uterus whenever it's ready to go through menopause. Tendons are a little different from ligaments, and we'll talk about why this is important, because if your bones are soft, the muscles that attach to them create a weakened tendon, and you hear about women having laxity in joints like your ankles and your knees. And people say, oh, everything is related to menopause. Everything is related to the menstrual cycle, which is all the way through to reproduction. And then ligaments, these are really, really tight rubber bands. They go from bone to bone. So when, as a chiropractor in my office, when I ask you to stretch and hold your stretches longer, so if you ever did like yin yoga and you hold a stretch for 3 to 5 minutes and you just stay there until your body falls apart, nicely, softly, that's when you've gotten into the ligaments. Blood vessels, we cannot forget them. One of the common things that will happen during menstruation and menopause, because of the process of anemia where you're losing blood, the blood flow can change. So capillaries work like this. They work in a bridge between the two. One end is the arteries. They carry fresh blood throughout the body. The other one is veins. So I always think of it as CAV, C-A-V. Capillaries sit as the bridge in the middle, and they're tiny, 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 but they allow fresh oxygenated blood, arteries, to travel throughout the body. And then when it gets dirty, it crosses over and comes into the veins. And the capillaries are the ones that do that. So those are tubes for blood. So here are some terms that we have. Let's talk a little bit more about the systems in the body. The nervous system. I drew all these arrows to remind you. This is a high school. Maybe you got exposed to it in middle school, depending on the school format. I went to a British school in South America. And so we were taught the systems in the body in high school because we go primary to secondary. But here in the beautiful United States, they teach a lot of this in middle school. There are many systems in the body. These are the 12, 2, 4, 6, 8, 10, 12 that we usually talk about, but there are other systems within systems. So these 12, these main 12 that we talk about, the nervous system controls every function of all the other 11, as well as the other systems within a system. So whatever you do in your body, your brain has got to travel down the spinal cord, out to the nerves, to the cells everywhere to carry the information. So God, in his infinite wisdom, has placed all of the information that he needs you to have in your brain. So as a chiropractor, my joy is keeping your plumb line open, realigning the bones of your spine gently and efficiently so that your brain can talk to your body so that all of these systems can work well. Today, we're focusing on the female reproductive system. Next month, we're going to do the male reproductive system. But every system is connected to each other because a woman in her reproductive system has estrogen, progesterone, testosterone as the three main hormones. So if you've ever seen a pregnancy test, years ago, they used to say EPT. I don't know if they say that now. But estrogen and progesterone, the T is for testosterone, which is dominant in males, but women still need them. Women still have it to have the tone of muscle and to help the rest of the hormones balance out. So God in his infinite wisdom created us where we have more of something, but it doesn't mean that we don't have all that we need. It's just what comes up when we need it. Now that we've finished with the systems, back to this. When I said balance your nervous system, it means finding a relationship with a chiropractor who does wellness work, light, gentle, specific, measured work. There are lots of people who move bones, but it doesn't mean that they're doing it in a very specific way. So be careful. Find out from them, are they helping babies? Do they work with pregnant ladies? Do they help the people who are over age 65? Ask them technique wise so that you can make sure that you're getting your nervous system balanced as you use these other hosts, these other stands to help yourself be healthy. Here's the bony anatomy so that you can get a perspective. If we found a pile of bones on the side of the road, we can tell if you're male or female. From many, many years ago, the Egyptians opened the caskets and they will talk, oh, I found a male and I found a female. It's because these bones never lie. When we find a group of bones, most people will use pictures of male bones, but there's a difference. If you look closely, there's a wider birth canal arch. There's a circle right here. And then there's a wider arch on the hips and pelvis. So that's why we invite women not to cross their legs at their knees. And if you must, do it at the ankle. But it's preferred that you don't cross. Because when you cross, you squeeze the width of your pelvis in, creating an opening at the tops of these joints called the sacroiliac joint, putting pressure on the low back. So crossing your legs stresses the pelvic and pelvis region for a woman. It looks cute, but it's not ideal. Not ideal anatomically. So if you're under my care, you'll see me always, people know that I'll tweak my fingers and say, keep your feet flat on the floor, keep them apart, nice and soft and gentle, because these angles on your hip called valgus and vargus angles, they need to be under your shoulders for your hips to be healthy so that you're not compressing your organs or creating torsion in your organs. And women are built very differently from men. So if you come into me and I move the three joints, big joints that I was talking about earlier, one of them is up here called the lumbosacral joint, and then two of them on the side called sacroiliac joint. If you come into me and I move your sacrum, I press on it and it does not move very well, I'm going to ask you, do you have a tumor? Do you have a fibroid? Or are you pregnant? And that's why I've got kids, because I've said to a woman, you're pregnant. And she said, what? No. And then she found out she was. Because if there's something growing in this bowl, your chiropractor will feel no movement. If one side is stuck and the other one is sore, or you have pain, the misalignment, even after we realign you, you've got to live in neutral, no crossing the legs and no rotation in your spine. Here's another look from the side. So here are the bones that I contact. See these bones, the sacral bones? That's fat, and here you have some muscles. Here's your digestive system. It rolls all the way down into the rectum. So if a person has a hemorrhoid, and I'm adjusting their spine, it can help with the tone and the retraction. If a person has diarrhea, constipation, or any digestive issues, when I work on their spine, it helps alleviate that pain and discomfort. We cannot forget the nice fold, what I call nice fold uterus right here. Most women, about 80% of them, are retroflex, meaning that the uterus is moving forward toward the belly button. A few women, 20% or so, are retroverted. So the uterus folds backward, jams into the digestive system. These women usually have a lot of digestive issues and a lot of low back pain. That's really hard after they eat meals or so. We cannot forget the beautiful ovary and fallopian tubes. It's like a hammock, how it hangs. The uterus is a hammock, and then you have your fallopian tubes on the side with the ovaries on the side. And then here's the position of the bladder. Here's the vaginal canal. So we've got a ureter, right? Urethra right here. Sorry, urethra. You've got the vaginal canal, and now you've got the anal passage right here. These three are so close together during a menstrual cycle when the body is cramping, your digestive system goes up, low back pain, your bladder, people who have frequent urination or have trouble urinating. All of this whole area right here is disrupted during a menopause cycle, from menstruation all the way to menopause. Here's a beautiful picture. I'm going to pause so that you can take a picture of it. I thought it was pretty clever, whomever created this. It was not me, but I like it. And I put it twice in here. It says the anatomy of back pain in women clarifies the areas of the back that are associated with specific conditions. So if your bones are soft or scoliosis, upper back and neck pain, and they describe spine conditions all the way down to muscle fatigue. Then in your mid-back, that poor posture, the weight of your breasts and chest, pulling your body forward, changing the angle of your low back, and therefore the positioning of your pelvis. So it means your uterus tilts forward, back, or to the side. And if it's carrying a fibroid tumor or a baby, you're in even more trouble. If you've had an injury like a car accident or a fall, or you're always sitting down and doing long drives in the car with your right foot pounding, the pelvis changes. And it describes all the way through to the lower back, all the way to the sacrum and the tailbone, how a woman can be in trouble. This is hard as a chiropractor for me to look at because often I cannot explain enough to a woman the fact that she's present because she's in pain. My heart is with her to make sure that her pelvis is healthy enough so that the rest of her body can function healthy. This is one that I came up with. To my left, your right is menstruation, and the opposite side is menopause. Does it not look the same? It's the same thing. Pelvic misalignment, hair, nails, and skin, fibroids, painful menses, adenomyosis, which is a tissue outside of the uterus, endometriosis inside the uterus inflamed, constipation, diarrhea, infertility, fibrous breasts, right? Lumpy breasts, ovarian cysts, anemia, tired all the time, brain fog, insomnia, mood swings, muscle spasms, weaknesses. You have a weakness. So they have a spasm and then their legs go weak or their body goes weak. Scoliosis, menstruation, you have hot flashes and chills. That's why you sweat. Headaches. Women can suffer as many as 21 different types of headaches, but sometimes on top of those headaches, I know I have to teach a headache class. People have been asking for it. About 21 different types of headaches that a girl can go through, but migraines in specific can be stirred up during menstruation because of the endocrine, estrogen, and progesterone when the cycle bounces back and forth. But look at menopause, same thing. Pelvis misalignment, hair, nails, and skin changes. Difference here, instead of scoliosis, they talk about osteopenia, which is softening of the bone, and osteoporosis when there are holes in the bone. Same thing, constipation, diarrhea, fibrous breasts, ovarian cysts, brain fog, insomnia, spotting. So while in menstruation, you can have painful menses or heavy menses or scanty menses, during menopause, women can have spotting and it can go on for days, 40, 60, 50 days. They're like, I don't never have a full period, but I'm always wearing a liner because I'm spotting. Same muscle spasm and weakness, anemia because blood is built up and lost, bone pain, present on both sides, but more conscious on the menopause side. So this is the woman who comes and said, I am always achy. I am always hurting. And I don't know if you can hear the pain in my voice because while I don't want to say to her, my patient, it's related to menopause because menopause is a life cycle. I want to say to her, don't be afraid because one day this will stop. It will, it will ease. This is the body trying to change hormonally what's going on. So I'm concerned, and I'll say make a spot here because here are hot flashes and chills, painful intercourse, vaginal dryness. Vaginal dryness happens on both sides. There are some women before their menstrual cycle happens, they can get a yeast infection because vaginal dryness appears. So here's my concern. When somebody gives you a hormone, artificial, to help manage these symptoms, it's going to manage some of them, not all of them. And so you don't know how much is enough. And when you come away from the steroids, what will your body report? And there are lots and lots of studies out there, but I am not an expert on hormonal replacement. I'm an expert on all things natural. And so this is what I'm teaching from. I'm saying to you that menstruation is menopause and menopause is menstruation. It's just two ends of the cycle. Menstruation is starting the fertility process. Menopause is saying we're no longer reproducing. But it's a pause. It's not a full stop. God did not say that you can stop. Because you get this amount of reaction that's happening for you, right? Because what happens in menopause is these fibroids calcify. So the bone, the osteopenia and osteoporosis, calcium leaves the bones and calcifies the fibroids. So while in menstruation, they're still soft and we can get a myomectomy and remove them because we know fibroids appear in a couple of ways. They can be outside the uterus, inside the uterus, inside the muscle, inside of the lining inside, and it could be pedunculated, hanging like a grape. Once you start to go into menopause, the body pulls calcium from the long bones and it calcifies growths in your body. So it calcifies them in your breasts, it calcifies them in your ovaries, it calcifies them. It makes these fibroids become calcified. The body just rearranges what it has. Here's this picture again about how, for me, I want to emphasize how important it is that you get your nervous system realigned, even as you're getting your head realigned to the fact that as much as God called you to be the mother of all living things, this menstruation, and people crack all kinds of jokes about it, starting with the word MEN, the three letters MEN. But menstruation to menopause is a journey, and it is have to tell yourself that it's easy and that you can order each part of it into making it easy, and you'll see, or easier, I should say, and I'll come to that in a moment. Here's a nice picture. I like this picture because it shows the rhythm of menstruation, right? So before you get into uh, perimenopause, anything before perimenopause, before age 40, there's this little nice bounce back and forth that happens for most women. Some women, it's not this easy, but there's a nice bounce of estrogen, progesterone, testosterone, and it bounces back and forth, and is a regular cycle. Then the body starts to flatten it out, pound it like a mortar pestle. It says, hey, we're not having any more children. So let's break this down. The body literally creates a fire to kill off the eggs. That's what a hot flash is. In menstruation, it heats it up to warm the eggs so that they can travel because you were born with them and they're stuck in their shell. They're stuck in their groove. So the body warms up around the egg and just starts to get it to go. That's why young ladies may be hot, cold, chills, right? If they're cold and clammy, anemia. Now in menopause, the body says you no longer need these eggs. So the way we're going to kill these eggs is we're going to change your estrogen, progesterone, and literally light them on fire. So if you say, I want to stop my hot flash, and Dr. Levi holds her head, is because I don't want you to stop your hot flash. I want you to go through it and be done with it. Let the fire burn the eggs. Because if you stop the hot flash, if you keep taking stuff to stop the hot flash, you are extending the perimenopause period. You are keeping the eggs around. And the eggs around are going to tell the body, I need estrogen and progesterone and testosterone. And you will lengthen the process before you get to menopause. Stop trying to stop your hot flash. Endure. Positive mental attitude. Change your sheets. Make sure that they're sheets that are absorbing. Sleep without clothes. Take a cool bath before you go to bed. Open your window if it's safe for you to do so. Use a fan, whatever it is, but go through the process and stopping a hot flash. Because if you don't, the eggs are going to stay around, and then your menopause period, your perimenopause period is going to be very long. See, God designed it so that in menopause, you should be quiet. Your body should be quiet, and you know. Check this out. Here's a reminder again. We're going to focus on a positive mental attitude. Just like you came through menstruation, I'm bouncing back to this, and you have endured all of this stuff going on with your body. I mean, because it's a big disruption to your nervous system. Remember this chart that we had up here where the nervous system controls every function in the body? Do you see how menstruation and menopause, menstruation to menopause goes through all of these systems? Because one thing I did not note, because I told somebody I'm going to stop using the word FAT, is the weight gain. I did not write it on here because every woman knows that she'll inflame. We know that during menstruation, you can gain between 5 and 10 pounds. And in menopause, you can gain 40 to 50 pounds. The body is going through what it's going through. And our job is to support our way through it and I'll show you in a moment how. Help is on the way. I advocate for a magnesium complex. Because magnesium comes in several different forms, I do not separate magnesium This is like saying I'm going to pick out the yolk from the egg. The whole egg has all of the good stuff. Eat the whole egg, please. I'm going to eat a strawberry and I'm going to pick out the seeds. I'm going to eat almonds and take off the skin. What? Eat the whole food, please. And that will help you. If you're under my care, I do specific dosing. And at the end, you'll see I'll send you to my store because in our store, we have supplements that have this for you. Vitamin D, please, fresh sunlight. If you must supplement, it needs to be taken early in the day on an empty stomach before you've taken other foods or supplements in, with one exception, thyroid medication. If you're taking Synthroid, Armathyroid, anything to support the thyroid, you take that first, wait 30 minutes or so before you take anything else. Vitamin D needs to go through the supplement, not more than 1,200 international units, needs to go through the liver first to upregulate the liver, what we call help it to detox. And then we've got turmeric, curcumin, need to go together, reduces inflammation. Caution with ginger. While it helps menstruation to reduce muscle spasms, it's a blood thinner, thins the blood. So it breaks down the clot. So if you use ginger when you're on your cycle or just before your cycle, you're going to get big, gushes, heavy flow. So it may still be between 2 to 7 days. The average is 5 days for a woman, but you'll have heavier flow if you take ginger, and you'll have to change more frequently. So just be on cautious with that. If you're in a menopause, it's hard on the stomach. It calms the gut for a little bit, but it can get very hard on the digestive system. So ginger, be gentle with ginger, be light with ginger. And even in primrose oil, my caution about buying oils, make sure you buy small quantities because they go rancid. Do not buy the big bottles. Do not buy the big bottles. Do not buy the big bottles. Small bottles because they go rancid. You open the bottle and then it will make you sick. But omega-3 fatty, 6 fatty acids, sardines, walnuts, whole foods. Here's some more foods that can help. No chocolate, nothing fried, and rest the flesh. Because any animal, chicken, duck, if you use eggs, turkey, they are high in estrogen. I know. So I'm saying to women, when you are feeling in a state of disruption, whole food, plant-based is best. So you said, oh, I'm on my cycle and I think I need some chocolate. Maybe you need some water or a piece of fresh fruit or some chia seeds. Maybe, or a piece of beet. Or you need a cup of hot tea or a good soup to nourish you, a bone broth. So if you must eat flesh, small amounts, small amount. So don't eat chicken eggs for breakfast and a chicken sandwich for lunch. You're just inflaming your body and creating more. During a season of expression, be gentle with yourself. I advocate whole food, plant-based. Here's some more. These are the herbs. From chaste berry, I want to be careful. If you take chaste tree and you take, especially if you take our products, it will stop your menstrual cycle. It's designed to lighten your flow, but it could lengthen your days. So be just gentle with it if you're taking chaste tree, if you're menstruating, if you're in menopause, heading into menopause, and you want to have some regulation, then, and you're skipping and it's uncomfortable with you, then chaste berry can work. People like ashwagandha because it helps to improve the sleep. You have to be careful with some people who are taking medications. This can create a problem. Black cohosh is well known for night sweats and vaginal dryness. You're going to take it light. So these are supporting. This is not replacing the journey. So if you're like, it's really, Dr. Levi, it's really making me not comfortable. I need some help. You're going to come on, try it for a little bit and rest it. So you're not going to stay on it forever. Or supplement bottles are 90 days. So you can, but it lasts for a whole year because you can go a week on, a week off, or one day on, one day off. The goal is to just give yourself some help, not replace. Motherwort is a very bitter herb. And so if you're from the Caribbean, we use bitters, Kerala bitters, and that will help clear your body out using that regularly. That will help the bowels clear out. Red raspberry leaf is really good to take as a tea, tincture, or tonic. Be careful if you're doing your own tinctures that you're not causing a fermentation. Cran bark is really good to help, not replace. Maca root, people will take maca tea, drink, be careful with it. Careful, 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 be very light. And here's another one, rhodiola, ginseng, and schizandra. I've seen people have rhodiola, ginseng, and rhodiola, schizandra mixed. Imagine this for a second. They're three distinct herbs. If you think of rhodiola, it's to run. It helps everything go fast. So if you want your brain to clear up very quickly, you're going to take rhodiola. However, ginseng, as long as the one that tickles on your tongue, it makes your tongue sting. Ginseng it's solid, it's gold, it's long lasting, it's resilient, it stays forever, but it keeps you hyper. So ginseng, if you think of it as ginseng, I'm gonna sing unto the Lord with a new song. So if you take rhodiola and ginseng, you're gonna raise your energy very quickly and could become very hyper. If you take rhodiola with Schizandra, Schizandra is shh. So if you've taken a picture of this slide, Schizandra is a shh. Schizandra is a calm. If you feel like you're hyper all the time, then you're going to take rhodiola with Schizandra. Okay?